Welcome everyone to another episode of Where Medicine Meets Ministry. Dr. Cherie talks faith and facts. Oh my goodness. Listen, guys, the story that you're about to hear today is one of family, one of love, one of sisters, one of a medical career, a life changing transformation, all within the same bloodline. And the power of this testimony will reach you and reach into the depths of your soul like you never thought possible, because the words that you will hear are not just real, and they certainly are definitively some where medicine meets ministry moments. But this goes deep and personal. And these two women are willing to share personally the tragedy that occurred in their lives and how they were able to spin it and make a positive change and a mission and a ministry that has been a blessing to hundreds of patients. Now, this story is a story of two sisters who left their primary careers to build a wellness practice after witnessing their parents suffer from obesity and the resultant kidney failure, amputations, heart disease, and in addition to cancer that all came along within this same family. These women have certainly experienced quite a few where medicine meets ministry moments and have demonstrated how one can turn their personal pain into their purpose. So get ready to hear a story that will make your jaw drop. Please help me welcome Dr. Goldie and her sister, Miss Beautiful Carla. Ladies, welcome to the show. How are you guys doing this morning?
Happy New Year, Dr. Cherie. We're good.
Happy New Year. So excited to meet you, Dr. Cherie. I'm very excited to be on with you today. And I'm Coach Carla.
Oh my goodness, you two are absolutely beautiful. For those of you that are listening to this podcast, just the audio version, please. I really hope that you have a YouTube account, or you just go out to YouTube and watch this video, because you need to see how God can beautify you in your mission, in your ministry. And I'm telling you, if I were to walk into your clinic, I'm sure if you probably had some men to walk into your clinic and say, you know what, I really need to do something different about myself, you could pretty much tell him anything he wanted to hear. He's going to do it, because beauty certainly opens the door. So listen, I want to jump right in, and I want to start with you, Goldie. When did you decide that you wanted to become a doctor?
I decided from the time I was 14 years old that I wanted to become a doctor. And so I was in high school.
Wow. See, and you know, my story is I wanted to be a doctor ever since I was 2. So I couldn't imagine being anything else. But certainly at 14, that is still a very young age to have that revelation, right? And so now you're making up in your mind when you're 14 that I want to be a doctor. How was it like? Tell me about your family dynamic when you were growing up. You know, like how many total siblings do you guys have? And, you know, what was a typical day? What was a typical diet? What did you guys do?
Okay. So like in my family, there were 4 children and 2 parents in the household. I also have 2 half sisters as well. But there were 4 of us growing up, and my parents were childhood sweethearts. They married really early. They were 17 years old and 21 years old. And they're just the sweetest. They were the sweetest people you ever want to meet. Kind-hearted, good, loving people. And I think through the course of their lives, just life happened. Stressors occurred. Things happened in the family, which kind of dissolved the marriage. And in that period of time, I saw both of my parents be excessively stressed. Both of them were excessively stressed. Now, in their life stresses, I remember my mom becoming an emotional eater and just being stressed out and like using food to comfort her feelings. And my father, he was like just, I want to say a sugaraholic. He was addicted to food, and he would eat like Snicker bars. He would have a drawer full of Snickers, and we look in there. Sometimes we try to sneak a candy, and he actually would remember. He would recall if we had taken a Snicker bar, and he would just get us about that. And I can just remember my parents just being sort of addicted to food. Okay. So although we had, typical working class household, I can remember on Friday nights, that was the night that we ate out. That was the night that Dad picked up food from the fast food restaurant, and that's what we would eat. And so, although my mom, she was careful to make sure we were provided for with good, healthy meals, I could see that their habits were habits that were unhealthy.
Yeah.
And I didn't really realize how bad it was until I went to medical school, until I realized about, different diseases being related to, our behaviors and being related to how we live our lives, what we eat and such. And I can even remember being a resident or a young attending, being like in the doctor's lounge, and in walks a cardiologist. And I remembered, oh my gosh, that's my dad's doctor.
No way.
Yeah, because my dad had a triple bypass by the age of 49. So very young. So he had coronary artery disease. He was developing diabetes and all of this. But the whole time he was in denial about the need to change his life habits. He was in denial. And so as I began to put together that, you can't just live your life a certain way and not change. And I started to realize it's really important that people are educated, and not just educated about disease processes, but like are counseled.
Correct.
To change.
Correct.
People need to be counseled to change. And so, I was starting to put that together, but it wasn't until years later that I decided, okay, I need to shift my career. So it was a series of things that happened.
Okay. So I want to bring up 2 points, and then Carla, I want to get to you. So one, I think is very important when you stated counseling them, because there, you and I both know that we can, or the three of us know that you can tell a patient, give a patient a diagnosis, right? Or tell a patient about their lifestyle, and they may understand that what I'm doing is not right. But without the tools to help them change, that's what you get with that counseling. You get tools, you get that hand holding, because sometimes you get to a place where I know that what I'm doing is not right, but this seems insurmountable because I don't know where to begin. Like a hoarder. It's like after a while, they have surrounded themselves with so much. I want to get out. I realize that this is not healthy. I realize that I'm at risk, but I can't help myself. What are those steps? So we're going to get back to what you guys did to help individuals develop those steps. Now, Carla, how was it for you growing up in this environment? So, Goldie, she gets to go off. She's going to med school. She's getting this, garnering all of this medical knowledge and understanding. She realized and picked up initially, this may not be so good, but we know when we growing up, child, we see Snickers in the door, we like, yeah. But then she got to a place in her medical career, no, this is not healthy. This is not right. You both have witnessed your dad go through these multiple health challenges and yet not seeing change. Carla, what impact did it have on you?
Okay, so I'm going to clarify a couple of things. We are sisters-in-laws. I'm actually married to Dr. Foggie's brother.
Oh, and I'm glad you brought up that clarification, because this goes to show you that in-laws can be in love. I call my sister-in-law my sister in love.
Yes,
and truly, and see, and again, people need to understand and hear this dynamic. Sometimes we set up a certain thing and we think that we can't develop a closeness, that we can't develop a mission and work together, and that, oh, it can't be. But you are living proof.
Yeah.
Well, yeah, because we actually grew up as best friends. We lived across from each other.
Okay.
And so basically, I had my family dynamics going over there, and she had hers in her house. And basically, we call ourselves friends, sisters, and now transformers, because we're transforming lives.
Yes.
And so that's our story. But I'm on the opposite end in another home where my family was not actually junk food eaters. My parents actually cooked healthy meals, didn't actually bring in cookies and candy or any of that. Matter of fact, when I wanted a Snicker, I would go across the street. But I experienced a different trauma in my family home because I was sexually molested by the time I was 10 years old, which opened another door for me, Doc. And so, but at the same time, Dr. Foggie was my best friend, and I told her, you know how the word says when you confess your faults one to another, healing begin.
Yes.
Already, when you start the process of healing by me telling Dr. Foggie, even Dr. Foggie just Goldie, this is what's happening to me. This is what happened to me. And it also started bringing my acceptance and my reality to my world, that I had been through some trauma. And the first thing that I said is, God, if I had been fat, this wouldn't happen. Make me fat. That started my journey to 297 pounds. And
Stop. Stop. I need you to repeat that because that's powerful.
Yes, ma'am.
You stated again, this would not have happened. Repeat it again.
This would not have happened to me if I was fat. This would not have happened to me if I was fat. That process of starting to hide, to use food to comfort, to lose yourself, because I teach a class that talks about what happens when the woman comes out of the little girl too soon. And that's what happens.
Yes.
And so basically that started my journey of being basically insecure, fearful, sheltering back, and just going to food.
Yes.
So that thing of, by the time I went to high school now, I'm 150 pounds. By the time I'm graduating, I'm 180. By the time I'm 22, 21, I'm 200 pounds, you know?
Wow.
And I'm ballooning and I'm ballooning. And it just continues because you don't really deal with the issues of trauma. And that's the part that I coach and I counsel with. I start with, what is your story?
Yes.
How did we get here? Because once you face the reality, whatever that, you know, post-traumatic stress is, we've seen people see their husband get shot. When I went to the first class with Dr. Foggie with the Obesity Medicine Association, when I heard the doctor stand up there and say, we got to deal with women that's even been molested because they go to obesity. And I was like, God, they're talking about me in this class.
Yes. Yes.
So at an obesity conference, I heard them talk about molestation, which blew my mind.
Yes. Yes. Because you probably hadn't even necessarily thought of that being your trigger. I mean, your weight became your wall.
Yes.
It became your wall. It became your protector, right?
Yes.
From your initial insult that traumatically and dramatically changed your life. And so knowing your story, that story that started it, that story that you continue to feed rather, is important to identify, because
Absolutely.
now that you know the story, you can now create a new ending. Right? You're already a part of that story, but you can change how it ends.
I can change how it is.
Oh, wow. We getting deep here. We getting deep.
Yes.
So now I want to correlate, Goldie, when you're witnessing all of the health challenges that your parents are going through. Carla, are you now married you're married into the family, so you're witnessing some of this as well, right?
Yes, right, because these are my in-laws now.
These are your in-laws.
Parents, right.
Yes,
I'm
yes.
right there
Now does your husband know at this time what your trauma was?
Absolutely. From day one.
Okay,
yes.
Beautiful. So now husband knows, Goldie knows, you're witnessing the health challenges in your in-law family, and now you have identified, whoa, wait a minute, I have something that I need to deal with. How do the two of you, or do the two of you have this revelation together? Or Goldie, do you get the revelation that I need to do something different because I don't want to see patients go through, or anyone go through, what I saw my patients go through? And now I'm looking at Carla, and I know her pain, and I'm gaining some understanding, because I'm looking at, one, we have to address her pain, period, because psychologically that's going to impact her. But we need to address her pain because physically I don't want to see her go through what my parents have gone through. Because you start off as an OBGYN, right?
Absolutely. So here I am, an OBGYN over 20 years, and I'm going through the motions of life. As a professional woman, I'm overstressed. I'm not getting enough rest. I'm watching my running group run by me without me. right? I'm not able to prioritize my own health. And then it dawned on me, if I don't have a life change, this is going to happen to me. Illness, heart disease, stress, heart attacks, all of that happens to normal sized people too, right?
Absolutely.
So a series of events happened in my career that led me to the point where I said, I've got to do something. I've got to do something. So I was an OBGYN. My parents died both back to back, like suddenly, 4 months apart, both of them gone.
Oh, that's hard.
I'm working in an area where I hate it. Hate it. It was overwhelming, right? I had a patient, and I've never told this story publicly before. I had a patient who received a misdiagnosis on a sonogram, and I believe the big contribution was her extreme obesity.
Wait, oh my goodness. Oh,
All
my
of these
goodness.
things happened, and I said, I got to do something. So I started going to obesity medicine conferences, and I'm in love with the whole specialty. I'm in love with the idea of helping people, really giving them the tools to change their lives. Because as an OBGYN, you're in and out of exam rooms, you're in and out of the operating room, you're in and out of the delivery room, and you're really not having the time. You're not given the time to counsel, to really give people the tools that they need to change. And yet you're seeing the complications of pregnancy. You're seeing the complications of even surgery as you're operating on people who are, increasing in size more and more and more. And then you feel helpless because you can't do anything.
Correct.
So I said, I'm going to do it. I'm going to start a weight loss clinic. And I did it.
Whoa.
Yeah.
Whoa.
So in 2016, I launched Illinois Wellness and Weight Loss Centers. And what do? You start practicing on your family and your friends. And my sister-in-law came to the clinic.
Yes.
And I helped her to lose tons of weight.
Now, Carla, tell us. Now, she didn't help you. Goldie. See, and that's the perfect name for you, because you are indeed golden, my love. When she's working with you, tell us how long was your weight loss journey, and give us some significant or real moments of emotion that like really triggered. Maybe, I don't know if it was the first 5 pounds you lost, or maybe it was the making up your mind that I'm going to do this and committing. Did you sign a contract that's going to hold you accountable? Tell us, how long did it take you, and what did that mean for not only you personally, how it affected your marriage? How did it affect your relationship with Goldie? Ooh, sucky now. For those of you all listening, you can't see the look on Miss Carla's face.
Well, when you lose 110 pounds, it has effect on your marriage, because you're almost a whole nother person. And we've been there for 31 years. And God he raised up my husband for me. I tell you that. Because being able to share your trauma and everything that you've been through, he was a support system. And it led up to a train of events in my life as well, because I worked 30 years as a chemist for the Illinois EPA. And I'm in management. And the lab that I worked at was pretty much a 24-hour lab that was open around the clock, weekend. We were the cleanup for the United States. So we always had an emergency somewhere. And I was there on the weekends, there at night, all the time, working sometimes 65 hours a week. So I felt like I was a doctor, just like Dr. Foggie. I would go in at 2 in the morning, at 4 in the morning, just all crazy kind of hours, and really had ballooned almost to, at one time, 297 pounds. And basically now I'm on blood pressure medicine. My blood pressure at one time was 200, I believe in 2015, over 100. And I actually passed out and I was hospitalized over a weekend. And so by the time I came here in 2017, I was broken. I was broken. I was tired. I had tried everything, because I was an active woman, always trying to lose weight, but never also now with career and family and 3 kids. and not being able to make time for yourself and losing yourself and not being able to identify and really discover, how I really got here. What's the catalyst that brought me to this place? And now my back is up against the wall because my health is really challenged now, and I'm in trouble. So I sat here broken when I first came, and I needed help, and I needed all the tools that this place gave me. And I believe God used Dr. Foggie to start Illinois Wellness because it's a place of healing. It's a place of transformation and life change. And when I came here, my mindset was, what do you want me to do? What do I need to give up? How do I need to start? Because my mind was like, I've eaten everything out there anyway. There's nothing I can't give up.
Correct.
I was ready to start. So, and then in going through the process of the coaching and the accountability, because the pillars are, nutrition, physical activity, behavior, medicine if needed. So these are the pillars here. So we dig in. We teach you the difference between a craving and a trigger. We dig in and help you with where you are. We do, the journey starts now. You got to love yourself right where you are. It's not defining a number before you get to that place in your weight. Can you love yourself being abused? Can you love yourself because we got daddy issues? Can we love ourselves because I was rejected by mom? And can you love myself because I've been through a divorce? What made you go here? And what's your story?
Correct.
And as I tell my story to patients, layers come off. And people start evolving because they realize food is just a cause and effect. I was hiding behind that food.
Correct.
I got stuck somewhere and I didn't know how to get out. We do so many things here. We say sometimes you've fallen and I can't get up. I had fallen and I didn't know how to pick myself up when it came to my health.
Wow. And see, when I hear both of your stories, and I want the audience to appreciate, stress changes everything. Whether or not it is a emotional, financial, the stress of abuse, everything that we are hearing, your story, Carla, and your story, Goldie, stress was at the heart of it. And whatever that stress trigger, whatever those stresses are, we know that they can have significant impact on your weight, and your weight can have significant impact physiologically on your bodies. And so there are individuals who are right now living with diseases, chronic diseases caused initially by some form of stress and or trigger that they did not have the proper tools to be able to deal with that particular stressor. But when you came, Carla, to the Illinois Wellness and Weight Loss Center, you came at a place of surrender. And I like the way you said, when I came, I just looked and said, what is it that you want me to do? Because a lot of times when individuals, if we look back and examine why we avoid facing challenges, fear is often what stands in the way. And so when we are willing to address and realize that there is going to be fear when there is change. Fear whether or not I can do it. Fear, can I stick with it? Fear, will this work? Fear, will people think negatively about me if I don't go at a particular pace or space that they think I should go in? But when we realize that it's not about getting rid of the fear, but it's about moving forward in spite of, because fear is going to be there, right? Having that courage to move past it and being willing to surrender. And really, in order for anyone to move forward past any trauma and to build, when you decided to come out of OBGYN and decided that I am going to shift my career, that was a place of surrender. Because you and I both know what we go through when we have committed, especially 2 decades to a field, and then you immediately have to switch and flip. People may think that just because you're an MD, that it came naturally. No, it did not. This is another whole field of practice that you now have to learn, study, dig deep, and to be able to apply prior knowledge, but flip it so that you can now give individuals the tools that they need to truly live, thrive, and survive. So I
Yeah.
want people to know that you looking at these beautiful women, they making it seem like, child, yeah, so I just decided to start this facility, started with my family, and boom. No, 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 no.
That's right, Dr. Shuri. You are so right. Because my transition has been a gradual transition. And people have looked at me and said, what? You don't want to deliver babies anymore? What are you doing? And so it's hard.
Yes.
It's hard to tell people, well, no, I'm 54 and I'd rather sleep in my bed at night with my husband.
Hello.
Right? And I'd rather have a life where I can get up and I can do my workouts and not be at the hospital. And people don't understand that, but it's something that I just longed for. I longed for a change in my own life. And I realized it was like kind of not nagging at me for years and years and years. And I didn't know what it was, but I realized I wasn't in the space that I belonged in anymore.
Correct.
Not to say that, I did not bless a lot of lives by delivering, babies and helping women, and I enjoyed it while I was doing it. But now I feel like I want to practice medicine in a different way, and it gives me such joy and pleasure. But yeah, being an entrepreneur is a whole new thing.
Whole new ball game. And when individuals, it's so funny how we can look at, and in the world that we live in now, people make choices and they flip-flop so much within an hour. But somehow when it comes to us, especially when we as Black women, super women, superwoman, right?
Yeah.
We mothers, we single family homes. I mean, we doing our thing, right?
Yes.
A lot of times when people see us in a professional position and they see us willing to step out on something that's risky, coming from us culturally, it's like, you better hold on to that sure thing. You talking about going and doing what?
Yes.
But when you are led by God, when he
Yes.
has developed and brought your character to a place and he says, this is your season to move out of here, and I'm going to use those initials behind your name, and I'm going to use that to open up some doors, because this is the place and space that I want you to be in. Everybody around you can question. Sometimes it can become tiring and stop you from moving forward, but it's just like, oh, wow, you know what, guys? You looked at me and saw a smart, intelligent woman who was delivering babies and performing surgeries and doing what have you for the last 20 years. I did not just lose my mind. I'm now just going to use my talents and my gifts, and I'm going to put them in a different place and space. And so step back and watch me do that and encourage me. You see what I'm saying? And you all did it. That's why I had to have you all on the show. Now, before I want people to understand and appreciate. Okay, so I walk into your facility and I say, it's me. It's me. And I say, you know what? I think I'm finding myself nibbling and I'm putting on weight, and I can't really understand why. What can I expect? I'm 53 and I'm walking in and I'm postmenopausal, and I feel like I tend to go to food more. My schedule is a little bit more laid back, but I want to make sure that I'm on track. I'm doing what I'm supposed to do. What can I expect if I were to walk into your facility and say, you know what? I just need help. I either want to lose weight or I just want to make sure I maintain. Walk me through a process, because you mentioned, Carla, at one point, pillars. I really want, you don't necessarily have to go through beginning to end, but I want people to appreciate why your center is different, because it is. It's not just two beautiful Black women who have decided to switch their careers from both very stressful positions. Not to say that what you're experiencing now isn't stressful, but it has brought you a relief because you're doing what brings you joy. And there is a difference when you can wake up in the morning excited about what you're doing and smile at night knowing that you've made a difference. That stress level is not the same. So tell people what to expect if they were to walk into your facility.
Okay, so if you come in our facility, the first thing you're going to get is a body composition. We start with you. And basically, you fill out a little questionnaire on what you just talked about, where you're at, that menopause, what's happening, emotional eater, nibbling a little bit. And we kind of do your consultation. We start with a body composition, which identifies a few key pointers about where you at in your body. You know, your basal metabolic rate, how to start, your caloric intake, muscle mass, water, different things like that. But then I give you kind of a first transformation lesson on just macronutrients, some basic eatings, how the body breaks down food, and usually insulin being the culprit of a lot of the weight gain because most people are eating too many carbs. At our center, we are a medically supervised weight loss center. And so what we do is we're going to get an EKG from you. We're going to get tons of blood work because we look at you from the inside, those kidney levels, liver function, thyroid, vitamin D, all those good platelets and, you know, all that stuff. So we're going to look at you from the inside out and we're going to see what's going on in your body. Is your metabolic cholesterol? Do you have metabolic syndrome? You know, are you pre-diabetic? We need to get a full diagnosis of what's happening on the inside of your body. This happens at your first consultation, that information, that transformation lesson. If you decide that you didn't even want to stay with us, you would have enough information, even from that lesson, to begin a change. But by the time you talk to us and I tell you the accountability and staying connected to the community that helps you go to a next level, because I tell people this, I am you. Because I've been there. When you've journeyed and you've tried to lose weight for 30 years and you've got the stress and you have the family, when you come in here at 53 and we're both 54, I tell you, I'm going to partner with you. And that's what you get. You get a partnership, a family in here that take you by the hand and we don't let you go until we teach you and give you the tools to change. That's what you get when you walk through the doors.
Okay. I got goosebumps because if I could have sent you a script to read, it couldn't have been more perfect because I did my research before bringing you on. And so I love what you bring. And I wanted you to point out the fact that giving individuals tools first requires understanding the individual you're dealing with. And to fully understand an individual, you have to have the desire to even want to understand them. And sometimes people don't appreciate that. They think that we as physicians, and there are some that we have a standardized, checklist of labs we order. We come back, we look at the labs, and a lot of times you get so caught up in the hustle and bustle that if you're not careful, you find yourself treating the labs and not treating the patient. And so what you described is, I'm using the labs to understand how to treat this patient. See, I'm using the labs so I can break it down and explain it to you such that you understand what will happen when I pick up that piece of cornbread and I eat it. And it measures a certain ounce. This is what's going to happen in my body because I know that I'm dealing with a carb versus what happens when I'm dealing with a vegetable that contains certain vitamins versus what will happen when I take in a protein. I can gain a better understanding of what's going to happen with my cholesterol levels, what will happen with my any type of liver toxicity. So I love the fact that not only when I come there, I will gain a family, I will gain a partner, but I'm gaining tools to help me change bad patterns and behaviors that caused me to get to the place where I'm at now. And now I can understand why I was doing what I was doing. That's the only way I can change it.
That's the only way I can change
I don't
it.
understand why I'm doing it. I'm just going to keep doing it because I don't know how to change from doing it because I don't understand the process. You break it down and you understand. And not only do you break it down and you understand, you have the clinical expertise that's like out of this world because it takes something. I was originally in neurology and got into it, loved it, but I realized like you, I'm like, oh my God, I'm going to have to be on staff at like 3 different hospitals. I am never going to see my children. And I switched and went into occupational and environmental medicine. Monday through Friday, no weekends. I'm only on call if somebody dies on the premises. And so, yeah, I had to go through the questioning of people. Oh my God, you're going from neurology. What is occupational medicine? Do you do occupational therapy? I mean, they had all kind of questions that I had to clarify what it was that I was doing. But in making that change, I now was able to use some of my past knowledge in order to plant seeds and open up understanding to individuals now in doing what I'm doing. And so you have the clinical expertise and can break it down. You have the lifestyle witness testimony that it works. I couldn't imagine a more perfect couple. And get this, you know, that was ordained well before you even thought her brother was fine as all get out.
Absolutely.
And
Absolutely.
when you decided you was going to go into OBGYN, God said, yes, 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 go ahead and do that, my child. I'm getting you ready. You got the hours. And see, now when I get ready for you to do this particular work, it's going to be a breeze for you, honey, because not only are you lived through the testimony of seeing the experience of what happened with your loved ones, with your parents, and with your sister-in-law, right? And that passion drove you to do something different. He already had placed, you didn't have a peace where you were. Something needed to be done. And so you followed that. And I want individuals to understand and really hear that when you no longer have that peace and there is a restlessness in you, search out that restlessness. Stop trying to keep yourself in a season that is over for you.
Yes. Oh my gosh, you're so right.
Yeah.
I can remember being in a practice where I felt like, am I on Mars here? Everybody is so happy. What is going on? But it was me.
Yeah.
I was the outlier. And I didn't know it until later.
See? So break out of that season. When it's time for you, I want you to break out of that season. People, if you're listening to my voice, break out. Now I'm going to ask a question, and I want each of you to answer it separately. How has following your passion and purpose changed your life's journey?
Like you said, I wake up in the morning thinking about how I'm going to help people to get well, to prevent disease, to feel better, to prioritize themselves. I wake up thinking about it. I go to bed thinking about it. And although it's been a struggle because this has been a shift, a financial shift, having kids in college, all of that. But my husband, he sees me and he says, wow, what a happier woman. He sees the joy in my heart. He likes for me to be home too at night. How about that?
Hello.
For the first time in 22 years, I'm home at night. And he loves having me there. And so although it's been a difficult shift, it's one that just brings me joy.
Love it. I love it. Carla, what about you? How has following your passion and purpose changed your life's journey?
Sometimes when you're on this journey, you don't always know your purpose, but you're in pursuit of it. And sometimes being connected to God, you find yourself just being who you are, but you evolve and you start being who God wants you to be. And I didn't realize that the 30 years that I spent trying to lose weight and how miserable it was, that misery actually turned into my ministry. And that's actually what this is. Because, when I quit the environmental field, I came over here, became a certified health coach. And I love to call myself the master coach because I pursue it every day as well, looking for something to help the clients become better and taking them to the next level and giving them the tools, educational and from the experience, and even arresting them. When I tell them, sometimes I'm like, listen, I might get a pass. I'm like, you got a demon chasing you, the same demon I had about 6 months ago, and we need to let that thing go. And we deal with it on different levels. We deal with everybody, but it's ministry, and I love it, and it's a piece because this wasn't all for me. Your misery, God uses every piece of your story, your narrative. Nothing's missing, nothing's lacking. So all of that was for such a time as this, to bring me into this place, to be complete and whole, so I could actually help and give out to somebody else.
Correct. I'm looking at two beautiful women who are living out their Esther moments.
Yeah.
Because for me, I see two women who in following their passion and their purpose, I see that your life's journey is not nearly as much of a struggle as it was before. And I want the audience to understand, does not mean you will not face adversity. Does not mean that there may be that you haven't had some sleepless nights. Does not mean that financially the money was just rolling in, because starting
Right.
off a new practice and building up patients, I can promise you, you don't even have to tell me how much money you spend. I know you spend cash money, because starting my own business, it took the same thing. But there's something about when you are living and walking in your purpose and in your passion and with passion. Even when I face these adversities, there is a level of our faith that just stands up, so that when the adversities hit, you know that you are walking and your footsteps are ordered. And so even
Yeah.
though that adversity hits, I get to shake it off. God will
Mhm.
now put me in a place where I felt like a door was closed, and immediately when I'm about to go this way, oops, nope, it opens up. And so know that when you do walk in your purpose and in your passion, your life's journey won't be as much of a struggle. Does not mean you will not face adversities, but that struggle won't feel as great of a struggle, because there is a level of peace walking in
Yes.
your passion and purpose. It's a
Yes.
level of peace. Peace that passeth, surpasseth all understanding. And with that comes the ability to exemplify a faith that's going to push you through the adversities you may face, because you know that you are walking in the will of God.
Yes. Absolutely.
And I'm telling you, where are you located? We say illness, wellness, and weight loss centers. I need to do some pub, but instead of me doing the pub, I'm going to ask you the questions. Where exactly are you located?
Illinois Wellness and Weight Loss Centers is located in Chicago. We're in the heart of Beverly. So we're located at 9933 Southwestern Avenue, Suite 200. And yeah, that's where we are.
See, I mean, and, you know, for people that are from Chicago, you remember the plaza? Okay. So
Yes.
just, you know,
Yes.
so, you know, where the plaza used to be, you know, you just head a little
Yes.
further south right there. I know exactly where you guys are. Now, before we finish up today, I want to give you guys the opportunity. One, let the listeners know, one, how they can get in touch with you. And then two, any other pieces of parting advice or any words of wisdom or whatever it is that you would like to share. The floor is yours.
Well, our website is ilweightloss.com. And our number is 872-702-4254. We're located on all the social media platforms. On Instagram, we're IL Weight Loss. On Twitter, we're IL Weight Loss. And on Facebook, we're Illinois Wellness and Weight Loss Centers.
Perfect. And any parting words that you would like to share with us?
I just want your listeners to know that we are here open and available to help you to prioritize yourself. And our center is not just for people who want to lose weight, but it's for people who are looking for wellness. And I tell you, like Carla said, you're going to get a family when you come here.
Wonderful. Now give us that phone number one more time.
872-702-4254.
Perfect. Goldie, Carla, two beautiful women on the south side of Chicago doing their thing. The Illinois Wellness and Weight Loss Centers truly can provide you a transformative experience that will not only change your life from a weight perspective, it would change your life from a wellness perspective. And do understand and appreciate that wellness involves and entails the entire man, mind,
Yes.
body, and spirit. These
Yes.
women got it going on. And if you need the help, I'm telling you, there's no other better place to go in the Chicagoland area than to go and see Dr. Goldie and Miss Carla, the master coach at the Illinois Wellness and Weight Loss Centers. Beautiful ladies, thank you so much for your time, for being on the show. And guys, thank you so much for listening to another episode of Where Medicine Meets Ministry. Dr. Cherie Talks Faith and Facts.